e-learning module is designed for Marin County Health and Human Services community coalitions doing substance use prevention in Marin County, California. In this series, we have Foundations in Prevention, including some live workbook activities designed to build the capacity of preventionists. Welcome. This e-learning module is designed for Marin County Health and Human Services community coalitions doing substance use prevention in Marin. Let's start with an introduction to the concept of prevention. The U.S. Department of Health and Human Services, through the Center for Substance Abuse Prevention, describes the role of prevention as creating healthy communities in which people enjoy a quality life. This includes supportive work and school environments, drug and crime-free neighborhoods, and positive connections with friends and family. Most specifically, the field of prevention aims to create communities where individuals, families, schools, faith-based organizations, and workplaces take action to promote emotional health and reduce the likelihood of mental illness and substance abuse. Prevention initiatives include evidence-based strategies that promote youth development, reduce risk-taking behaviors, build assets and resilience, and prevent problem behaviors across an individual's lifespan. Historically, prevention has been a community practice, but in the last decade or so, we have evolved into a profession. Prevention has a body of sound scientific research to support the efficacy of the work, and as a field of practice has a set of principles and a distinguishable set of practices that is separate from the treatment and recovery fields, although with obvious crossover. The prevention field promotes science-based or evidence-based prevention. This means practicing prevention in a way that is based on good science and is consistent with the results of scientific research. There are many core sciences that contribute to prevention as a science. This includes neuroscience, genetics, epidemiology, psychiatry, and behavioral sciences. Prevention also has close ties with the field of mental health. Some scientists, practitioners, and theorists consider substance use disorders as part of mental health, others consider it as part of behavioral health, and others consider it distinct from either. Those who work in the field do so in a variety of settings across private, nonprofit, and government sectors. Preventionists may be stakeholders, volunteers, or professionals. All preventionists benefit the work by operating from a common knowledge base and with proven standards of practice. Strategic prevention follows a very simple formula. First, we use data to identify problems. We use criteria to prioritize those problems, and then we develop specific goals and objectives that are aimed at changing the problem. We need to determine how to effectively approach the goals and objectives in order to create the desired change by identifying evidence-based or effective programs, practices, and policies. And finally, we monitor progress toward the desired change on an ongoing basis as a means of continually refining the work that we're doing, as well as documenting the achievements that we make. In this e-learning module, the Foundations in Prevention, we have 4 live workbook chapters. Each section provides an overview and then includes some live workbook interactive activities. The workbook chapters include data-driven and evidence-based prevention, action plan, monitoring and evaluation, and environmental prevention. The e-learning module is designed so that you may skip around or go back to or begin at any point in these chapters. In this chapter of the e-learning module, Foundations in Prevention, we'll be exploring data-driven and evidence-based prevention. This is a core capacity for Marin County preventionists. Let's take a look and see how do we use data to make prevention decisions. Pronounced data, sometimes pronounced data, all we need to know is that data-driven decision-making is based on information. We all have access to information. We use it all the time to make decisions. If you use Yelp, if you use Outlook, if you use a grocery list, if you use your smartphone, if you check the odometer on your vehicle to decide when you need to get an oil change, you're using data to make decisions. When it comes to prevention, we're doing the same thing. We're using different pieces of information to make choices about what's going to be the best prevention action to take. When you start thinking about using data to make your prevention decisions, don't get too wrapped up in what that might look like. There are lots of pieces of information that are going to be valuable pieces of data to help you make informed decisions. Whether it's a survey or a questionnaire, an interview, a casual conversation that you have with a student in the hallway or a parent on the phone. It could be data that you're collecting from your local law enforcement or hospital. It could be something that young people are gathering as a means of calculating outreach to merchants or beer cans found littered in the park. Again, don't overthink it. Data is all of the information that you can get your hands on that are going to help you make an informed and intentional decision about your prevention work. What's the point of gathering data? Well, going back to our commitment to do strategic prevention, gathering data, gathering that information, allows us and others to see what is the root of the issue. What is the impetus behind the activities? What's driving the change that we're trying to make? So, if we commit to gathering that information, much of which we probably already have our hands on, and we'll talk more about where to collect additional data, we use that as a starting point for our strategic prevention conversation. A lot of times people call that conversation a logic model, and that's the graphic or illustrative representation of the strategic prevention that we're doing. But if you were just going to talk it through and connect the dots for someone who didn't know much about your work or didn't know much about prevention, you'd want to share with them first the evidence of the problem. And then you'd want to talk to them about the theory for how to reduce that problem. And then you would describe specific activities that you're implementing based on that theory. Finally, you definitely want to share the result of the activities, because that's going to demonstrate the change that you had in mind when you engaged in prevention. And finally, you want to show what the outcomes are, the change that resulted because of all of your prevention efforts. So, to start again at the beginning, we need to build that case, that foundation for what is the need, what is the opportunity for prevention, and that's where data comes into play. For those of you doing prevention work, you may be familiar with two of the formal processes for gathering data. One is called a needs and resources assessment, and the other is called a gaps analysis. These are formal mechanisms for which we can pool all of that information that we've been talking about, whether it's quotes from focus groups, interviews from parents, results of a questionnaire, data that came in from the hospital, pooling all of that information together and connecting the dots and then seeing where there might be holes, seeing where there might be gaps, is going to help make sense of all of that data. It gives us a map of the landscape of need and opportunity in your community. It helps us see where there might be people who are falling through the cracks or communities that are being marginalized or underserved, and helps us hone in on where we dedicate our prevention efforts. I want to spend a little bit of time just walking through how data fits into the big picture of making decisions. So as I described, many of you have access to information already that drives the prevention decisions that you make. But what are the steps? What are the pieces of the puzzle that fit together to make strategic prevention? As we've been discussing, gathering credible information from multiple sources is the first step. What you're going to then do is review the information to find out what are the problems or opportunities. Oftentimes this involves multiple representatives across sectors as well as stakeholders to help review and make sense of the information. Next, you'll be determining based on criteria the priority problems or opportunities that you're going to focus on. So no doubt the data is going to show you that there are a number of needs, and being able to meet all of that needs is our goal, but making realistic priorities for how we serve the community is going to be essential to moving the needle. Based on the priorities that we establish, we're going to go ahead and create goals and objectives that define what we intend to change about the problem or the opportunity. I want to make clear here that this is not about defining the activity that's going to happen, but rather what is the change that we want to see. Based on the change that we want to see for our community or for our individuals, we're going to then select and implement prevention activities that are most likely to achieve the goals and objectives. The reason I'm highlighting these two boxes is because oftentimes they get mixed up and people start by focusing on what are the activities they're going to do rather on what's the change that they want to see because of those activities. Moving along in our decision-making chain, we continue to use data to keep track of how it's going and what the progress is towards meeting those goals and objectives, achieving that change that we want to see. We regularly measure and share findings about our goal and outcome achievement. We share it internally so that we can engage in continuous quality improvement of the work that we're doing, and we share our milestones and achievements with our stakeholders, with our staff, in order that we make sure that we are getting credit where credit's due in achieving the change that we set out to make. And finally, we begin at the end, using information to make more decisions. As you can see, it's an iterative process, and data is fundamental to all elements of the decision-making phases. Okay, so we're at our first live workbook activity, and we're going to use this as an opportunity to get a sense of what data we have at our fingertips. In the following slide, you'll see an example from our kidsdata.org website where you can access local data relevant to making substance use prevention decisions. I'd like you to watch that quick video and then spend some time on kidsdata.org looking at data that matters to decisions you need to make in order to provide responsive and effective prevention to your community. Getting access to data can be one of the trickier things in making data-driven decisions. I wanted to show you one of the best websites that I've come across that offers a compilation of data from a variety of credible sources. It's called kidsdata.org, and you can see I have it pulled up on the browser here. There are lots of different types of data and information provided on this website. I'm going to show you how we can look at it in two different ways. First is if you want to search data by topic. The other is if you want to search data by region. Again, there are lots of features on this website, so part of this live workbook activity is going to be to have you explore kidsdata.org. Let's take a quick look at some of the options that are available. I'll start with data by topic. As you can see, there are some big picture categories here. I'm going to drop down to emotional and behavioral health and look specifically at youth alcohol, tobacco, and other drug use. Now there are a number of variables here that you could examine based on what your interests are. I'll go ahead and select the top one, alcohol and drug use in the past month. Now one of the features when I'm looking at data by topic is that it initially populates for all counties in California. You can see on the left side here, I'm going to clear all, and then I'm going to go ahead and use the bar in this column to scroll down and specifically hone in on what we have data available in Marin County. Marin County school districts are listed here, and so you can select multiple if you would like, or you could select one. I'll go ahead and just pick a couple. And as you can see, it automatically starts populating what we have as substance use in the last month for high school students in these school districts. Now, as you start clicking around, you want to not only look at the data here, so right now they're sharing by grade level on the left side, 7th, 9th, 11th grade, and any versus none. If you're familiar with the California Healthy Kids Survey, which I happen to know is where they're pulling this data, you'll know that there's other levels that you can take a look at. But I wanted to show you just quickly some of the other tools that are available in this interactive website. You can make this data automatically into a pie chart if that's something that would be useful for sharing with stakeholders or for understanding decisions that you need to be making for your prevention work. And so again, I want you to take some time in this live workbook session to go ahead and explore kidsdata.org. I also want to take a look at the option of data by region. So I'm moving off of the data by topic field, and again, you can see that there are lots of pieces of information that are regionally organized here. I'm going to go down to Marin County, and you can look at cities or school districts. For our purposes, I'm going to go ahead and look at school districts. And you can see that it has data, again, from multiple sources, not just the California Healthy Kids Survey. And we'll go ahead and pick one of these districts to take a look at. And as I mentioned, there are a range of different types of information in here. So if you look at the view data by category on the left, you can select the ones that mean the most to you. Again, I'm going to look at the factors that are associated with substance use prevention. And here we have the Novato Unified Alcohol Use in the past month. Okay. This table in particular is showing you how alcohol use in the past month is related to level of connectedness in school. Now, one of the things that's really cool about the data.org website is that if you want to find out more information about any of the data that's on here, you can click on it, and it will provide you a summary with information about why the topic is important, so how it connects back to your substance use prevention work. It also provides you with additional data and resources if you want to explore or learn more about it. I'd like you to now take some time to explore the kidsdata.org website and find some information that's new to you and then help you drive your prevention decisions. In addition to using data to make decisions at the outset of your prevention strategic planning, you can also use data concurrently or simultaneously throughout all of your prevention phases. So this is called the data loop. We know that we're starting at the beginning with the needs and resources assessment to get a lay of the land. What are the needs and opportunities that our gap analysis points us towards? We've established priorities and then made decisions using data about what activities will best meet those goals and objectives that we have established. Throughout the course of implementation of our prevention, we want to do continuous quality improvement, and that's driven by data as well. We can use ongoing review of data, such as satisfaction questionnaires, assessment of registration and participation rates, and other process-level data to determine what's working, how well it's working, and what changes or adaptations we need to make in order to continue to be effective, optimize our prevention efforts and resources, and also think about refinement to our array of services. That's right, in our data loop, we also want to take a look at making strategic streamlining or strategic abandonment of prevention programs and services. When we have to make changes to the array of services that we're providing, making data-driven decisions can ensure that we're continuing to provide core or essential elements of prevention while reducing the array of supports and services if need be. Finally, in our data loop, we're going to get to outcome evaluation. We'll talk more about that as we move forward in this e-learning module. What I want to do now is zoom out. So we've been talking about our data loop, but I also want to talk about our bigger picture decision-making loop. So earlier in the module, we looked at the stepwise process for making prevention decisions. What I've done here is abbreviate that into an iterative cycle. And what we've focused on so far is gathering information, identifying issues, and selecting prevention priorities. What I want to move on to next is a more in-depth look at what we mean when we talk about evidence-based prevention. That's going to directly relate to our goals and objectives regarding those priorities, as well as implementing evidence-based prevention, or doing relevant EBPs. So as we move through this e-learning module, we'll look at this overall iterative cycle of strategic prevention. But for right now, what I'd like to do is move us forward and dig a little bit deeper into what evidence-based prevention really is. One of the things that we want to spend time understanding is what is evidence-based prevention. This is definitely related to the discussions that we've had with regard to data-driven decision-making in prevention. But when we talk about evidence-based prevention, we're talking about some very specific considerations that help us determine the credibility of the information we're using to make those decisions, including around what activities we engage in with regard to prevention. Earlier in this chapter, I discussed data as a synonym for the word information. Most of us are familiar with the concept of information, and I'd like to tie that to the word evidence for our purposes here today. Again, evidence is just a collection of information that we use to drive our decisions. Evidence is information, but not all information is the same. We want to make sure that we're getting good, credible pieces of information to support our prevention case. The credibility and value of any piece of evidence is the subject of some interpretation, and that interpretation may be influenced by politics or other factors. There are varying thresholds for what is accepted as evidence, just like in any courtroom. The bottom line is that evidence exists on a continuum of credibility. It's not an absolute yes or no, it's evidence, but we need to consider the source and other factors that influence how reliable that information is. Let's spend a little bit of time understanding the definition of evidence-based prevention. Most simply, it is the use of programs or strategies scientifically proven to be effective in achieving desired reductions in or risk of And now you get to fill in the blank of your substance use outcome. Let's unpack that a little bit more. The Society for Prevention Science has established standards of evidence that are used to develop lists of model programs by government agencies. Focus is on the quality of research used to evaluate these programs. According to this definition, in general, evidence-based programs are based on clearly articulated and empirically supported theory. They have detailed description of the intervention and the measurement design, including what outcomes were produced in what populations using what type of intervention. They have measurable outcomes that have been assessed using psychometrically sound measures. That means the evaluation tools were reliable and consistent, oftentimes including long-term follow-ups. Evidence-based programs have been tested in a scientifically sound way with comparison conditions optimally through randomized control studies. Again, this is a very rigorous definition of evidence-based prevention. We're going to explore it a little bit further. What we're going to do now is explore the three main components of the Society for Prevention Science definition of evidence-based prevention. We'll start with grounding in theory. The following information is based on the Substance Abuse and Mental Health Services federal requirements for evidence of effectiveness. Grounding in theory means the strategy is based on a solid theory or theoretical perspective that has been validated by the research. The second principle for evidence of effectiveness has to do with an empirical track record. That is, that the strategy is supported by a documented body of knowledge, a converging of empirical evidence, or data, of its effectiveness that is generated from similar or related interventions that indicate effectiveness. So again, that's looking at multiple sources of evidence, of credible information that support the effectiveness of outcomes for a given strategy. The third standard for evidence of effectiveness is defined as the consensus of informed experts. This is an important principle to consider because it builds in room for cultural responsiveness as well as innovation for prevention activities. The strategy is to be judged by a consensus among informed experts to be effective based on a combination of theory, research, and practice experience. Informed experts may include key community prevention leaders, elders, or other respected leaders within indigenous cultures. Now that you know the three core principles for defining evidence of effectiveness, it's going to be important to know where you can find that information. There are lots of different possibilities for informing your understanding of whether a particular prevention strategy has evidence of effectiveness. There are agencies that accredit practices and strategies. There are academic research journals that document effectiveness. There are program and agency evaluation reports. And there are peer or expert review panels. Often finding this information can be a matter of doing an effective internet search. For this exercise in the live workbook, I'd like you to spend some time exploring the National Registry of Evidence-Based Programs and Practices. This is a composite website provided by the Substance Abuse and Mental Health Services Administration, and on the following slide, I walk you through some of the opportunities to set criteria for search terms and to leverage the summarized information about a variety of programs related to substance use prevention, including exploring whether the program is a fit for the goals and objectives that you've set in your community. Here we have SAMHSA's, the Substance Abuse and Mental Health Service Administration's National Registry of Evidence-Based Programs and Practices. What I'd like you to do in this portion of the live workbook is to open your web browser and go to www.samhsa.gov/NREPP. I'd like you to explore some of the opportunities to understand evidence-based programs that are collected here on the SAMHSA NREP website. The value of this website is that it doesn't make decisions for you. It doesn't tell you if a program is evidence-based, if it's effective, or if it's a promising practice, but rather what it does is compile an aggregate of information that you can use to make decisions, database decisions, about programs that might be right for your community. One of the things that you can do is go to Find an Intervention, and if you select this option, it gives you a range of search criteria so that you have the opportunity to enter the things that matter most to you. So for example, you might want to select age. So 13 to 17 will give you programs that are specifically designed for adolescents. You might also want to narrow down the number of options by the researched outcomes. In this case, we're going to look at substance use. You have lots of other choices here for how to select programs, but we'll start with that. After I select the criteria I'm interested in, I hit go, and then it will populate a list of programs that meet those criteria. For each of the programs listed here, you can find more information about the nature of the program, what evidence it has to support the outcomes, what implementation and dissemination available is provided by the developer, and what is the other contextual information that you need to know to implement this program. So in this case, I selected All Stars. As you can see, it gives a summary overview, and then it allows you to search for more information about this particular program. Again, this is a tool that you can use to understand what evidence-based programs and practices might be a good fit based on data. So far in this chapter, we've explored the process of using data to drive decision-making in your prevention work, and we've also explored and unpacked what we mean by evidence-based prevention. What I'd like to do now is spend some time examining how this ties into the prevention work that you're doing. The value of using data to determine priority needs and evidence to select effective programs is in the caliber of prevention work that results. Intentional prevention work, grounded in clear consensus around information, enhances productivity and reduces waste of resources. It creates transparency for all stakeholders, increases the confidence in the impact of prevention, and ensures the longevity of your efforts. Marin County has a long history of using data to drive decisions and evidence to determine what programs or practices to use. These are just a few local examples, and more information is available on the Marin County website. Before reviewing new or existing programs and strategies, work with the team to determine what criteria must be met for considered inclusion as a prevention program or practice. There are lots of different criteria that may be useful for you when you're deciding what types of prevention programs or activities to include. These are just some examples from previous Marin County strategic planning efforts. For more information about criteria, you may want to see some of the specific examples of these strategic plans that outline the decision-making process that was used, including the criteria that were set. Remember, when you're using data to make decisions, you want to be sure that you're using the process with integrity. Avoid backward justifications. Don't backpedal into decisions that you knew that you already wanted to make, but rather take an open-minded approach to gathering and reviewing information that will help you make informed choices. Evaluate each of the criteria on a continuum. Remember, it's not a simple yes or no, but you may want to put in place a rating system. Gather data and input for each of the criteria, and make sure that you're using this as an opportunity to really explore all perspectives and the full range of information that's going to drive informed decision making. One of the most effective criteria tools that I've used for strategy selection is the best fit model. This is from the Substance Abuse and Mental Health Services Administration, and as you can see, it creates something of a funnel effect, starting with the most broad level considerations around the relevance of a given strategy, focusing in on whether it's a practical fit for your context and your agency, and then looking at the evidence of effectiveness. We're going to explore each one of these elements in depth. If we're looking at criteria of relevance, we want to identify types of interventions addressing populations that fit your data-based priority problems, goals, and objectives. If the program, policy, or practice doesn't address the underlying risk and protective factors or conditions that contribute to the problem, then it is unlikely to be effective in changing the issue, problem, or behavior. Specifically, you want to make sure to address the community's salient risk and protective factors that are contributing to the conditions. You want to target opportunities for intervention in multiple life domains, and you want to drive positive outcomes in one or more substance abuse, problem, consumption pattern, or consequence area. If a strategy meets these criteria, we can consider it relevant. Here we have a brief example of a relevance check tool. This can be useful as you're reviewing prevention strategies to determine their relevance for your particular circumstances. You want to ask as a team, is the intervention culturally appropriate? Did members of the culturally identified group participate in developing the strategy or program? Were intervention materials adapted to the culturally identified group? Are implementation materials such as manuals and procedures available to guide intervention implementation? Are training and technical assistance available to support you while you're doing the implementation? And are there monitoring and evaluation tools available to help you track the implementation quality and progress towards your goals and objectives? Using this relevance checklist will help you determine if you meet this first tier of strategy selection criteria. The next tier of criteria has to do with practicality. Select interventions that fit with the community, resources, capacity, readiness, and complementing existing efforts. If the program, policy, or practice doesn't fit the capacity, resources, or readiness of the community, then the agency is unlikely to implement the intervention effectively. Here we have a feasibility check tool. Again, using this to guide your program selection is going to ensure that you are finding a best fit intervention given the goals and objectives that you're trying to achieve. These particular questions fall into three main areas. Is the intervention administratively feasible given the policies and procedures of the implementing organization? Is the intervention technically feasible given staff capabilities and time commitments as well as program resources? What about a need for fidelity versus adaptability of a given intervention? That's part of the practicality fit. And finally, is their intervention financially feasible given the estimated costs of the implementation, including the costs to purchase materials, specialized training, or technical assistance? Making sure that you run through these criteria as you're assessing your current or potential prevention strategies will ensure a feasibility of your implementation. Here we have a review of our earlier discussion around evidence of effectiveness. If you recall from our best fit model, this is the final tier for criteria of strategy selection. So we checked to see if it was relevant, we checked to see if it was practical, and now we're assessing whether or not it's likely to be effective. And as you know, evidence of effectiveness is based on a continuum. It includes clearly articulated, empirically supported theory, a detailed description of what outcomes could be expected for what populations in what context. There are measurable outcomes that have been assessed using scientifically sound instruments, and it has been tested in a scientifically sound way using comparison conditions or randomized control studies. In our final round of criteria application, we're going to use the effectiveness check tool to look at your existing programs or any programs that you're considering selecting for implementation. Using this effectiveness checklist will let you know that you're likely to achieve the outcomes that you desire. When you think back to your data-driven goals and objectives and the change that you want to see in your populations or in your community, you want to make sure that the prevention activity that you're selecting is likely to end with that result. So we'll ask ourselves these questions. Is the strategy consistent with the strategic plan, action plan, or other planning documents? What is the quality of the evidence? Is the strategy grounded in sound theory? Does the strategy allow for adaptation to the fit of the needs of the community? And will adaptation impact the effectiveness of the strategy? In this live workbook exercise, I'd like you to do a status check activity. Use the questions from the relevance check, the feasibility check, and the effectiveness check tools to assess one of your current prevention strategies, or use it to vet a new prevention practice that you are considering selecting. Does it meet the best fit standards that increase the likelihood your efforts will have the desired impact?